There's also less snow. The brown bears, ooh, someone's camera. The brown bears don't usually fall.
Norman Lovell Gallery, Homer Island, Alaska. Beautiful flowers.
I don't know. That's why I would.
That's food storage building. They will remove the ladder so that bears can't enter and take away the food.
No flash.
I know, what's going on? These are all pastels. In this room, next room is watercolor. You have been very busy.
Glaciers. Wood paintings. These are the northern lights. Aurora borealis. Seen from Norway. Kachamak Bay Cook Inlet. That's our ship, Holland America.
That means I gotta walk over there.
Yeah, I know.
Oh, mackerel.
Only it's halibut.
Yeah.
Halibut.
She almost clocked her head on it when she ran by.
Only one.
For those of you who want a beach walk, walking this beach is another option. Just take the bus, and it burnt all the buildings down in the 1930s because there was nobody out here. They didn't care. And it was pull us up here, and off your right-hand side would be where when we first left the boat. Is it still here?
Indeed true, because look how closely they fit even today with the position of the continents today. So over this hundreds of millions of years did break up, these pieces began to move, and we have something that looks like this today. Now, the largest and one of the most active of those tectonic plates is the Pacific plate that we see right. My clicker doesn't seem to work too. Right here, there it is. You will notice that it is moving, as they all are. The tree, what happens? Well, it rumples up the fender, for example, or the hood, and this is exactly what happens when the plates collide. They rumple against each other and create mountains.
This is a typical volcano, just like Misty volcano in Peru. Beauty. Today, small puppy.
Take a look at this similar mistake. That's a 6-inch clamp, and this is a 13-inch retractor. Nurses are supposed to keep track of how many tools go inside you and make sure the same number come out.
Sometimes the initial count going in is wrong, their count going out is wrong, and mistakes happen.
Something gets left behind in as many as 2 out of every 10,000 surgeries. If you have unexpected fever, pain, or swelling after surgery, ask if you might have a surgical memento buried within. Ahead on my list, air keeps us alive, so how does it kill this young man? And a mix-up at the maternity ward that leaves moms bonding with the wrong baby. Marcelino. In the nursery, he needs to eat. And a hospital worker hands the baby over to a stranger with the same last name. The wrong mother breastfeeds Monica's baby.
It's hard for me to accept that. Yeah.
18-year-old Blake Fout is excited to be going home. But before he can leave, Blake has one more thing to do. Have a tube in his chest removed. While he's sitting upright, a nurse removes the tube and then seals it with gauze.
You could hear popping from the central line site, and it was just... That's called a sucking wound, and what it was doing was sucking air right into the vessels.
It's called an air embolism, and that air misdiagnosed. Morgan McCracken gets socked in the head with a baseball. Mom and Dad ice the bump down. The 7-year-old seems fine until 2 nights later when she cries out for help.
Mom, my head, it's hurting. She was holding it. Saying, my head's hurting.
The McCrackens rush Morgan to the emergency room.
We couldn't get to the hospital fast enough.
I carried her in. She was too lethargic to walk.
A doctor says, don't worry.
I'm sure it's just late. She's tired. She probably has a touch of the flu.
A gut feeling tells these parents the doctor has Morgan's diagnosis wrong.
This wasn't our Morgan. She's had the flu before, and this wasn't how she acted.
They ask for a CT scan of her head, but the doctor won't listen. What is the consequence of a doctor not listening to you?
They're failing to hear.
And orders the CT scan. Here's what he missed. A blood clot inside Morgan's skull. 11. Transfusion confusion. Blake Oliver feels sharp pain in his stomach. He goes to the hospital. He needs surgery and a blood transfusion. The new blood has to match his blood. Some people are O-type blood type. So if you're getting blood, you can check the bag to make sure it's a match. At number 10, getting burned. Parameet Singh expects his heart bypass to go smoothly.
Yeah, no big deal. Just I want to maybe go home the same day.
Monitoring cables are snaked through Parameet's heart, but the monitor malfunctions, and the cables get so hot the inside of his heart is cooked. The damage irreparable, and Parameet has to get a new heart. A surgeon's laser punctures a hole in the balloon. The gases flow into Rocky's throat. Instead of stopping the surgery, the doctor continues. The laser's heat sparks the gases and fire explodes. Now, Rocky has to breathe with a plastic tube. How could a hospital burn a patient in a surgery? Ahead on my list, we all know our left from our right, so how does this boy's surgeon get so confused? And a routine test goes wrong and leaves patients partially bald. Look-alike tubes. Alicia Coleman is born 3 months premature, a disease all but destroys her intestines. To keep her alive, doctors insert a feeding tube into her stomach and a central line tube into her vein. One day, Alicia's mom drops her off at a medical daycare center and heads to work.
I handed her over on Saturday.
This toddler's heart, and she dies.
I've never got... She had to go through it alone, and I wasn't there.
Is it easy to confuse tubes?
We should be very cautious.
Something unusual turns up in 35-year-old Derry Eason's breast. Is it cancer? Doctors do a biopsy. Her diagnosis? Positive. Invasive lobular carcinoma. This single mom has breast cancer. She gets a second opinion. 2 more experts look at her lab work and agree. Derry decides she has to be aggressive to save her life. She has surgery to remove both her breasts. And then weeks later, a bombshell admission by her doctors.
They told me, basically,
didn't have cancer and you never did.
What makes doctors think she's sick? That biopsy showing she has cancer actually belongs to someone else.
Oh my god.
Aisle 7, having the wrong baby. Carolyn and Sean Savage want a baby after 4 miscarriages. They turn to a fertility lab for help. The couple thinks their embryos are placed in Carolyn's uterus. Until 10 days later when the lab calls with unbelievable news.
We were pregnant, but at the same time that they had transferred another couple's embryos to Carolyn.
The baby growing inside Carolyn doesn't belong to her. It actually belongs to this woman who has the same last name, Shannon Savage.
I'm thinking this woman has got to be a basket case. And then find out she's pregnant, oh, by the way, with somebody else's kid.
Here's how the embryos wind up in the wrong womb. To locate where the frozen embryos are stored, a lab worker, by mistake, uses Shannon Savage's paperwork instead of Carolyn Savage's. The worker 6, operating on the wrong body part. Jesse Matlock has a wandering right eye. The 3-year-old needs surgery to have it fixed. He goes in for the operation, and the surgeon cuts into the left eye instead of the right.
My husband and I were in awe. We're like, can you repeat that again? And she said, frankly, I lost sense of direction.
They messed up and did this one and then did this side.
Surgeons are supposed to initial or mark the correct side, like they did with Jesse. But here's one way they can still get confused.
We place drapes over the entire area to keep it sterile. Mistakes can be made very rarely when you have draping that obscures the mark.
In the U.S., 7 patients every day suffer body part mix-ups. Just before surgery, make sure you confirm with the nurse and the surgeon the correct body part inside of your operation, and don't be shy about doing it. At number 5, radical radiation. This isn't a bad haircut, it's the damage done by too much radiation. Michael Heuser goes 3, metal in the MRI room. 6-year-old Michael Colombini has brain cancer. He's getting an MRI.
An MRI machine is a very large, very, very powerful magnet.
A hospital worker walks into the room carrying a metal oxygen tank. The oxygen tank flies out of the worker's hands, shoots across the room, strikes Michael in the head, and the little boy dies. Take a look at this video researchers make after Michael's death. It shows just how fast that metal oxygen tank kills him. While this mistake is relatively unusual, reports to the U.S. Food and Drug Administration reveal additional cases. When you're getting an MRI, make sure there's no metal on or around you. At number 2, the ER waiting game. 2-year-old Malia Jeffers has a 101-degree fever, a bruise on her cheek the size of a marble, trouble walking. Her parents rush her to the emergency room. A nurse says it's a virus and tells the family to wait. So they do, for nearly 5 hours. Malia's fever climbs higher. Her bruise gets bigger. She can't even stand up. Mom and Dad ask for help again and again, but the hospital says keep waiting, until finally, Malia's father barrels past the nurse's station into the ER and begs. The real diagnosis? Shameful. A flesh-eating bacteria is rapidly spreading through the toddler's tiny body.
Any break in the skin.
Fingers on her right, and both her legs.
Is it always obvious who should come first in an emergency room? You can't always tell when someone really needs to be seen.